Hi, my name is Olubukola and this is a live session that I thought to do randomly, and I'm a nurse. I'm a registered nurse. I'm from Nigeria. I'm a registered nurse back home in Nigeria, and I'm a registered nurse in the United Kingdom as well. And there has been a trend in the general public at the moment, especially with the new one that has just happened, and it's just like the straw that has broken the camel's back, about nursing, how nurses are portrayed, how nurses are viewed, people's impression or orientation or conception about a nurse. Now, when you see a nurse, really, who do you see? It is very different. I don't know if a sick person sees a nurse as someone that can help them to get well, or they see a nurse as an errand person to the doctor, or they see the nurse as a sex tool, a sex object, a gossip, and all of that. And that is what we want to discuss today. Right, if you're joining in, whether late or not, you can see this video at the end of it, you can play it. It's just a session that I want to have to talk about these things. I really hope, I have people with like minds that will be coming to join me as well, just so we can have this topic of discussion. Also, I'll talk about how we are nurses, or who nurses are, and how we evolve, or how we have evolved, and also, how these things have really affected us as nurses, whether or not we want to talk about it or not, or yes. So having said that, I will start by saying that really, growing up as an individual, personally speaking, if I want to say the truth, I didn't have a good impression about nursing or nurses. And you probably wouldn't blame me. And it was because of the impression that I've had growing up. I see nurses as people that are lesser than doctors, if I have to say. And I had that orientation growing up, just with the little information that just like Mary Angelo would say, that with the little information that really, you can't do more than you know. So that was the information that I had, that was the orientation that I had. And I was going to study medicine at the beginning, and when we sing the song, I'm a doctor in my country, everybody knows me well, la 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 la, and you would see that oftentimes everybody wants to be a doctor because they speak highly of doctors. Everybody wants to be a lawyer, everybody wants to be everything, and maybe not a nurse. And you won't blame them really, you just blame it on what has been put in our head growing up, what our secondary socialization was like about nursing and nurses. So, and that is just pretty much it. And when I then wasn't getting into the university to do my medicine, I was having issues and all of that, and I was advised to go into nursing. I won't lie to you, I was reluctant, and that is why it pains me this moment talking about it, because I know that this impression that the entertainment industry keeps giving people about who nurses are, about what we like to do and all of that, it affects generations that are coming before us, because personally speaking, it has affected me. And it is not because I regret being a nurse today. No, I do not regret being a nurse today, but it is just to mean that indeed these things that you are doing, you're not just doing it because you feel like you want to just do a mythical video, put nurses and show them having sex with the doctor or having sex with the patients, or showing them that they say yes sir, yes ma to doctors and all of that. You're not just doing that alone. You are affecting people. You're affecting people's orientation. It hurts. To be honest, it hurts. And to be honest, like I said earlier, I didn't want to be a nurse only for that reason, because I didn't want to be seen in that light. So if I was that way, imagine the number of people that were hell-bent that they would not be nurses, no matter what you say to them, no matter how much you convince them, just because of a singular video that went viral of nurses sleeping with people, or of your TV series that we watch of nurses gossiping and all of that, nurses shouting at their patients, they don't respect privacy, they don't talk to the patients with courtesy and all of that. So, and that is just all what we're going to be talking about today. And I've actually tried to sensitize people, just to ask if a few people can come on board to come share from their own wealth of knowledge, and I will just be adding the few that I know as well. So having said that, I'll then move on to say that really nursing is a very noble profession, and we are role models. Indeed, you're not allowed, well, especially in Nigeria, you're not allowed to model for things because it's against the code of conduct and all of that. But we are role models. We respect our patients. And being a nurse, as an example, I am a graduate nurse, and no matter the route you take, whether you go through school of nursing or whether you go through the university, private university, whatever university you go for, you will see that we go through a rigorous process. I, for one, went to the School of Nursing, UCH Ibadan, and I know well the rigorosity of how my nursing was, and I can speak of so many nurses that went through School of Nursing, university of whatever university you went to get your nursing done and all of that. You're not allowed to get out of the school compound anyhow. You're not allowed to do things and so much more. We go through that. We have a syllabus. We just don't go in and out of the school like that. We have syllabus, and to start with, we do anatomy and physiology in year 1. We have our foundation of nursing. We do our pharmacology, and we do our behavioral nursing. We do our medical surgical nursing, to mention a few. If you remember some other courses that we did then, you know, as nurses, please drop them in the chat room. I really hope I can see my charts, because the last time I realized I didn't see some of my charts. So it's just to show that indeed we are nurses that have rationale for everything that we do. And in fact, the rigorosity of the nursing that I did in Nigeria is so much that even when I got to the UK and I saw that here, any little thing, they will tell you, speak to the doctor. That one, speak to the doctor. I wasn't comfortable with it at some point, because I was brought up as a nurse back home in Nigeria to reason. You have to reason. You're not a yes doctor or yes ma kind of person. You have to think about the rationale for everything and anything that you do as a nurse, and you're accountable for every action that you take. So we actually go through this rigorosity. We know the importance of nursing, and we cannot jeopardize it for anything. Thank you, Shekinat. Shekinat is reminding me, we did microbiology, we did biochemistry as a nurse. Do you understand? So it is not just you know, going through a quack or quack process and then getting your certificate. At some point, you will do exams at every level. There are some exams that you will do and you will get fished out if you don't. You get, taken out if you don't do well. So much more. I can't just keep going. You do your hospital final at some point. You will do your council exam at some point. If you do not pass, you have to resit. You have to stay extra 1 year or extra 6 months, depending on the case, and all of that. So to then get out of nursing with all of that rigorosity and see that you are being seen as, I said in the session that you are being seen. Yes, thank you, Yemi. Yemi is saying that we did family health nursing. Oh, bless you. How did I forget that? We did family health nursing. We did mental health nursing. We did a whole lot of courses. So we know what we are doing. I, Ahmed Mushrak, we know what we are doing as nurses. We did, I'm trying to remember really. Yemi is saying now that we did a lot. Indeed, we did a lot. So we know a lot. We are not a yes ma, a yes sir person. So when I was planning this session, somebody sent me a video. Thank you so much for sending me that video. And I watched it and I was really broken, because you would see that in that video, the children, I can tell you their heights, and their age won't be more than 5 years, not 5 years, say 10 years, between 10 and 15 years old. And it was in Delta State, and somebody asked them that, oh, what are you doing? You've got a uniform on. Are you a nurse? They said, I've been nurse now. Our school don't, because of COVID-19, our school is not open. So my parents paid for me to go and do nursing in that clinic. And they showed the clinic. I won't mention it, for confidentiality purpose, but they know themselves. And the person doing the video was really wowed. Do you understand? How can a 10-15-year-old child be doing nursing in a clinic, and they plan to get their certificate at the end of it? Obviously, they are auxiliary nurses, and those are the people that you will see washing the doctor's car, saying yes sir, yes ma to the doctor. And then every other person that walks past at that moment will think every nurse says yes sir, yes ma to a doctor, and they don't want to be a nurse for that reason, because they want to be independent. They don't want to be someone's slave. Do you understand? So you see how this whole auxiliary thing, I respect them, they know so much, but at the end of the day, if you don't go through the solid process, you are actually tarnishing our image. You think that you're trying to bridge the gap because we don't have enough nurses. Yes, shortage of nursing or nurses is everywhere in the world. So if you want to bridge the gap by creating quacks, then it is really, really wrong, because they are the ones causing these problems for us, these quack nurses, these auxiliary nurses. I think we need to face it and we need to say it. I have something in the comment section. Sekina said, we only have 3 weeks break in a year. Oh, thank you. So Sekina was my classmate in the School of Nursing UCH Ibadan, 2009 set. So we only have 3 weeks break in a year with all clinical experiences and classes, no time to waste. So I don't know what time somebody that went to a school of nursing or to university would have to go and sleep around, would have to go and gossip, would have to go and do all of these things that they paint us as. Yemi is saying, Yemi went to the School of Nursing Luth in Lagos. Yemi is saying now that even 2 weeks for our own school, that is the rigorosity of the nursing that we do. And even when I came to the UK to get my BSc nursing done, I saw it as something Yoruba will call it, you are using akara to eat pap. Because it was so easy. And I said to them that I would dust it, because if I don't dust it, then I'm a bastard. Because the rigorosity that I've gone through back in UCH Ibadan, there is nothing that can beat it. There's nothing that can be worse than the kind of treatment, the kind of thoroughness that has occurred, that has passed through me, and that I'm sure that has passed through every nurse, you know, that did their nursing in Nigeria as an example. And I can say the same for other African countries. I want to believe so. But if not anything, I can say that for Nigerian nurses. So that is to tell you that indeed we are not quacks. We are not gossips. We don't have sex around. I was watching an Hollywood movie about 3 weeks ago, or maybe a month ago, if not more, and I saw the way the doctor was talking to the nurse, if you get what I mean, and it was with so much insult. It was so dehumanizing. And if I was just a 10-year-old girl that was aspiring to be a nurse, and I see that video, I'll change my mind. I'd rather be a doctor. I'd rather be the one that would shout down at somebody. It shouldn't be that way. It is high time Nollywood stops this thing, because it is becoming an eyesore. Now, the nurse carried his file for him. You give very, very useless expressions of doctors are not bad people. I've met doctors that are one of the best people you can work with, especially the good ones. So, but you now then creating a movie and showing that the nurse is carrying the file after the doctor, and you're showing that the doctor is shouting down at the nurse, telling her to shut up, telling her to get out of your office. Tell me how many people would want to be a nurse with such treatment? Now, and that is why it is as if nursing would always, apart from other factors affecting the level of the nurse workforce that we have, it would always be on the low. Because if you show me in movies, in musical videos, that nurses have sex with their patients, nurses have sex with the doctors in the office, then I won't want to be a nurse. It is actually, it is the height of any insult you can think of, and it is high time we did something about it. Now, there was a time I heard that the Nursing and Midwifery Council of Nigeria wrote to the Nollywood or the entertainment industry, you know, speaking to them about it. I guess there were some petitions that were signed and all of that, and just to make them stop it. Really, I think they paused it a while, and they've started again, because this video that I said I watched on YouTube was just released a month plus ago. And it was so disheartening. And before that video, because I like to watch Nigerian movies sometimes, before that video, it was as if it was a roller coaster. Before that video that I watched a month ago, I watched one of another nurse sleeping with the patient on the bed in the hospital, on the patient's sick bed. And I thought, really, seriously. And I did a video, if I remember well, I did a video of the one of the doctor shouting down at the nurse, and whether or not I did the video of the one of the nurse sleeping with the patient in the hospital, I can't remember. But it doesn't matter right now. The point is, it is high time they stopped it. And what causes this, I don't know. I don't know if anybody knows the reason why we nurses are seen this way, as if we are lesser than every other healthcare professional. Because really, it is affecting us. It is affecting the good nurses. It is affecting our self-esteem. It is affecting our integrity. Because sometimes, whether or not we want to face it, some people don't even have the nerve to speak out, because they feel that the impression or the the impression that has been created or that has been painted of nurses is of that shouldn't talk back. Or that shouldn't, well, not talk back per se, but that shouldn't question anything that I've been told. I've been told by somebody that is a doctor that to give a particular medication. Do you understand? It was just a doctor on call. But then I understand that he meant it like for the patient's best interest. But I had another rationale for it. I said to him, this patient is not causing any harm to anybody. Indeed, he's restless. He's got jaws in place and all of that. But then if you knock him out, he just had lorazepam, I believe 0.5 milligram IV, if I remember. He still had it like less than 2 hours ago. Then the nurse rang again. I was the nurse in charge, and the nurse rang again to say to him that this patient is getting restless, blah, blah, blah. Then I got into the scene. I said, he's getting restless, yes. Is he hurting anyone? No. Has he got jaws? Yes. Have you got somebody special in him? They said, yes. So why are you hitting him with lorazepam? They said, because the doctor has prescribed here in the UK. And I said, no, because the doctor has prescribed doesn't mean that you should keep hitting him with it, because at the end of the day, it could go into respiratory depression. He doesn't need it. If you keep hitting him with it and he gets rested, at some point he was acting like he was drunk because he needed to stay active. I think he had alcohol encephalopathy, so he needed to stay active for some reasons. He has toxins all over his system, and at the same time, the effect of the lorazepam was hitting him down. And it was just, imagine somebody being at the middle and it was acting like someone that was, high on something. And I said, no, this is not fair. And at the end of the day, I said, do not give that lorazepam. And that was it, because after all, I should be my patient advocate. And I gave the rationale. Now, during the round, the following day, when we did the handover, I said to the consultants that came in, to take over, I said to him, when we would normally hand over every patient, I said to him, this is what has happened. And for this particular patient, we didn't give the second shot of the lorazepam. In fact, it was supposed to be the third shot before I walked into the scene. And the consultant said, why should anybody do that in the first place? Now, imagine if that nurse, if I hadn't walked to the scene and I hadn't made them stop that lorazepam injection, and that nurse had given it, and God forbid anything had happened to the patient. What would you say? She could lose her pin, you see, because at the end of the day, she was the one that gave. So you're allowed to speak. You're allowed to give rationale for everything that you say, in as much as you do it intelligently. These are the kind of nurses that we are. We are not quacks. And it is very painful. I'm trying to go through the comment section now. And Yemi said, no time to gossip or sleep around. Yes, we don't have the time. I went to the School of Nursing, UCH Ibadan. And the first time we got to UCH, our principal, bless her, Mrs. Afolabi, would tell you that if you like, go to ABH. Those that are UCH people know ABH. She would say, she would hit it in your head like a nail. That if you like, go to ABH and keep sleeping around and fail. Once you fail, I will kick you out. We were trained that way with so much dignity. Mrs. Afolabi is my friend on Facebook. I love her and she loves me, and it is because of the kind of training that she gave to me. There was a time she came to speak to us in class. I busted into tears because I said to myself, if I don't pass, I am in trouble. I know where my mommy got the money to send me to school. So it is very important for me to pass. I busted into tears and she said to us, is it either you pass or you pass? So it is very painful that you go through the rigorosity of this training and somebody makes you feel like you're a prostitute, makes you feel like every nurse is a gossip, every nurse is this, and people don't want to come into nursing. Everybody that sees you in that light. Now, I want to say this. For every rumor, there is an iota of truth. I'm not saying that indeed there has not been some nurses doing it, but what are the category of nurses that have been doing it? Are they the quacks? Are they the auxiliary nurses? Are they the small ones that people train from what's it called now? People train from in their private clinic and just give any certificate to. Who are they really? They need to be fished out. And Nursing and Midwifery Council of Nigeria needs to do something about these so-called auxiliary nurses. Something needs to be done, really. If not, they'll keep tarnishing our image. It doesn't mean that even the ones that go through School of Nursing, any School of Nursing or degree or whatever it is your route was, it doesn't mean that you cannot be that way. But at the end of the day, if 50% of us are not that way, how come everybody makes it look like 100% of us are that way? I'll just run through the comment section real quick. Thanks for everybody watching. Oluwatoyin says they know so much, but their practice isn't evidence-based. Oh yes, truly those auxiliary nurses, they can teach you back to back because they've been doing it over the time. They've gained experience and they know these things. However, it is not evidence-based. They can't say the rationale for some things that they do. They are the ones that you call sometimes when you are sick and you say, go and help me call the nurse in the next street. Do you understand? They will treat you, you'll be fine, really. But let them come tell you about the mechanism of action of that medication. They can't tell you. They can't tell you many things about it. So what are we talking about, really? Why should I then be treated or made to feel like I'm an auxiliary nurse or I'm a quack? I may be in the United Kingdom, but I'm still a Nigerian nurse at the end of the day. I should be able to stand for a Nigerian nurse. Something needs to be done. Thanks for everybody watching. And somebody has said, Kabzi K, speak the truth. Oh yes, the truth needs to be spoken at some point. Osinachi says, some of these issues are a result of the auxiliary nurses, which I strongly concur with. Because at the end of the day, if you know what you are doing, you know the rigorosity of how you got your PIN. Even here in the UK, how you do your IELTS. I did my IELTS. How many times? I lost count at some point. Not because you can't speak English. At the end of the day, you realize that examination is not the true test of knowledge. When you begin to write IELTS, you'll be hit down at some point. You'll be like, really? I did it so many times, wasted 150 pounds. At some point, it became 160 pounds in some centers. I then did my CBT. I then did my OSCE. Thank God I passed those ones once. And at the end of the day, I then get my PIN here in the UK just for me not to have sense, just for me to be sleeping around, just for me to be gossiping around, and just for me to be made to feel this way. This is highly wrong. I really don't know if the School of Nursing Nigeria it's not School of Nursing, Nursing and Midwifery Council in Nigeria is doing anything about it. I can bet there has been petitions signed, there has been letters sent, there has been emails sent. We haven't seen the results. And it is high time everybody, puts a voice together. I don't know how we'll go about it, really. We need to put our voice together and make sure that this thing stops. We are not how they are treating us. We are not how they display us. Osinachi also says that some people can't differentiate between registered nurses and auxiliary nurses. That is very true. You only see a nurse in white, and that is all you know. You don't want to know how, just come and treat me, just come and make me get better. How can we regulate it? We are licensed nurses, whether in Nigeria or in the UK or wherever you are in the US. We've got a regulatory body. But what is this body doing for us to help us? You need to help us, really. Because at the end of the day, this thing won't stop. Now, this whole rant started about 2 months ago, apart from this new one of Olamide's video. When Tunde had not posted something, I'm sure if anybody remembers vividly, should please remind me. It was targeted towards nurses. And every nurse that I know of, even in the School of Nursing group that I belong to, reported that post to Instagram. And Tunde Ednot was made to bring the post down. Yes, he brought the post down. Apart from bringing the post down, we even tried to report him to get that, his whole, Instagram handle, to bring it down. But I know it's a popular jingle on Instagram. That probably won't happen. But you hear some people say, oh no, it is what you guys are anyway. It is. So why do we get mixed up? Why do we get mistaken together? Why do we get rolled and mashed together and made to feel like indeed we are the same rubbish that we are? It shouldn't be that way. We need to call for help. We need to shout for help until something is done. Now, I was going to say something again. Then afterwards, we heard Olamide's video. I think the video was released about a week or 2 weeks ago. And Twitter has been bursting with comments of him saying, Woma, the title is Woma. The lyrics of the song itself is an eyesore. As in, it's an eyesore, like seriously, you can't even, it's so rubbish. How would you expect children that we are giving birth to these days to listen to songs like that? The quality has left Nigerian music. We still have the good ones, but it is painful that songs like that would hit the top, maybe top 10. You see Sound City busting it, playing it and all of that. I'd be like, seriously. And it had nurses in the video displayed showing sleeping with patients on the bed in one corner of the room and all of that and all of that and all of that. And he put a disclaimer. I don't know if it was him or his label or his producer or whosoever, but there was a disclaimer saying this is not targeted towards anybody. Excuse me, this is not targeted towards anybody. But the people that wear white uniforms are nurses in Nigeria that I know of. That is the uniform color. We now know that there are diversity where some people wear scrubs, some people wear colored, la la la. But when you see a white nurse, you see a nurse. That is all what we all know. Now, you have shown what a nurse wears, and you have shown the nurse sleeping with a patient, sleeping with this person, kissing that person in that corner, and you are giving me a disclaimer. Seriously. And it is so painful. He's not even saying anything about it. I don't think I've seen it on his Instagram page apologizing or anything like that. So if we do not stand for something, we will fall for everything. So it is high time we just, speak about these things. Paul Balaji says, I love your passion. Thank you so much, brother. He says, nice video. We need more advocates for nurses like you. Keep it up. Thank you so much. Liz Layemi says, quack. They have so much information that they use wrongly. That's very true. It is not helping us. And I don't know if I've jotted anything that I can then add to all of these things that I've said so far. It affects our dignity, our respect, our self-esteem. And what is the primary cause of this problem? Social media. Social media is the primary cause of these things, happening to us as nurses. And we need to stand for it. I don't know how large or how strong or how far this video will go, but I don't care how far it goes, but I will try to, in my own area, to try to make a difference. If I don't make a difference by saying, who will listen to me, it's been happening before I was born, it's been this, who am I, and all of that, then it will keep happening. Now, I need to speak in my area just like I'm speaking to you, and I have very lovely people commenting. I have people watching me right now. I have people that will watch me after. That is the change that I am making, and I'm challenging every nurse today to please educate somebody today. Educate them, educate their ignorance. If not, it will continue. If you want something to stop, you change the way you change the narrative. And that is why this video has been done today. I really appreciate those of you that have come in, to honor me and to add from your wealth of knowledge to educate everybody, really. And also, I've said that we are regulated by a regulatory body. If you're in Nigeria, you're regulated by NMC Nigeria, UK, NMC UK, on and on and on and on that way. And we know rationale for every action that we take. If I give a particular medication, oftentimes I know the mechanism of action. If I don't, or I don't know, some of the things like side effects, and I need to educate my patients, what I do is I go to the BNF. There's BNF online. You can download it on your app. There should be a BNF in every treatment room, in every hospital. I understand that we may not have this in Nigeria, but there's something like that as well. And if you don't have it in Nigeria, you can check on Google. You can check BNF on Google and get the rationale for things that you are doing. And just stay on the standard. I just want to encourage we, the good nurses, please maintain the standard as much as you can. Do not bring it down because of anything. Do not let your self-esteem be affected because of people that do not know more than they know, because of people that are affecting us, or those that are, tarnishing our images. Also, we respect our patients, privacy. We respect their rights. Do you understand? So we shouldn't be treated that way. You will think that by the time they want to release their videos or put their videos together, you will think that they should go to NMC Nigeria, or probably ask a good nurse, or probably ask, what was I going to say? There are bodies that you can use. Like we have the West Africa College of Nursing Nigeria. They can use things like that, to ask, okay, so how do nurses do? Okay, if a doctor says this, what should a nurse say? A standard nurse, what should they say? You can then use that as your baseline to form your video, to form your clips, that make up your video, instead of giving people wrong impression. I'll go on to read the comment section. Babalola Oluwatoyin says, auxiliary nursing needs to be abolished first. Oh yes, I strongly concur with that. It is one of the problems. In fact, I don't want to say major problem that we have, but it is one of the problems that we have. And once that has been achieved, a policy should be put in place to nail the Nollywood movie industry for any further attempt to tarnish our image as professional nurses. Oh yes, I strongly concur, because if a policy is not put in place, for them to meet, like a standard for them to meet before they release a video of a nurse, acting as a nurse in that video, then they'll keep doing it. There should be a penalty for anybody that releases a video with such, image of nurses, if you get what I mean here. And also, I think that is all with my comments, and that is I've just been thinking about it. I've just been ruminating about it, and it's just been so painful. And if you go through some comments, some very silly comments on Twitter, some would say that it is what you are. I've met some of you are that way, this and that are that way. I understand that the profession is mostly dominated by nurses, so for that reason, everybody that sees a nurse and sees that, okay, indeed there are more of women, as in the profession is more dominated by women, I mean, so they just see a gossip, they see a this, they see a that, they see every bad quality of a nurse even before you open your mouth to speak and show the stuff that you are made of. So I'm trying to see if I've got any other jottings. I don't know if anybody has anything to say, but then it's just a misconception. It is a misconception. It is a misinterpretation of who we are. It shouldn't be. It is high time things like this talk. I'll share my video as far as I can share it, and I will educate every ignorant person that I know that nurses, real nurses, I'm not talking about the ones that you train in the back of your house, or the ones that you train in your clinic, or the ones that carry your file for you, or that wash your car for you. I'm not talking about such nurses. Standard nurses. I've got a nurse that is of, you know, of great standard, that has gone through uni or school of nursing, whatever it is that you have gone through, you know, has got a lot to offer than having sex with patients. That is not who we are. We are not sex tools in any way. Simisola Oshin says, do we even have a policy governing these nurses? I do not think so. Because if it was a registered nurse coming on air for commercials, you will see somebody from nursing council coming for their license. Oh yes. So obviously it is just, they just get a uniform. Maybe they get a tailor to sew a uniform for them. They dump it in their body, and then put a cap on their head and let them act the role, or make them do the musical video and all of that. And it is totally unfair. They don't have any policy governing them, really. So this needs to stop. This really needs to stop. I will keep talking about it. I'll share this minutes, so I think I'll just stop it before it goes up. It says something about my storage. So that is just all I want to talk about. So it starts with you and I. Do not say that there is nothing that can be done. Do not say it is not my business. Please intentionally make a change. Intentionally, you know, educate somebody today about who real nurses are. And also, I'd like to say, if there is a way we can sign a petition, I will find out about it. If there is a way we can put a letter together, I will find out about it. And we'll see how we can, you know, push this forward, so that things like this will just stop at the end of the day. Babalola says, Oluwatoyin, the public needs to be sensitized on their right to refuse nursing care from quacks. Oh yes, care recipients also need to be actively involved in their care. The more knowledgeable the receiver is, the less they endanger their lives. This will go a long way. I strongly concur with what Oluwatoyin has said. The reason being that at the end of the day, if you sensitize people, if you create adverts telling people who a nurse is, Jonathan, that is what you'd expect a nursing council to be doing, to be honest. Indeed, you don't like nursing to be in the face of adverts or anything like that. But then there should be a way to sensitize people, you know, about who a real nurse is, and also to tell people to refuse nursing care quacks. And in a way, you see what I mean here. Some people cannot afford to go to a proper hospital to get the best care. So they'll rather call a quack nurse that got their certificate from a clinic when they were 15 years old, and they are practicing as quacks. They rather get their certificate from there, and you will call them because you don't have money. So it boils down to poverty sometimes. It boils down to lack of knowledge sometimes as well. And just like Tony has rightly said, care recipient here in the UK, some patients, when you want to give them their medication or you want to do their dressing, they'll tell you what dressing to use. They'll pick it out for you. They'll tell you what it's for. They'll tell you what medication is for. Apart from say they've been using it for years, they'll tell you that they've read about it. They have NHS app on their phone. They have Google to help them. We need to be more informed. Some people have got everything that they need to stay informed, but they have just chosen ignorance. And it shouldn't be that way. Google your care yourself. Okay, you're having this, and this medication has been prescribed. And you know, just do it that way, if you get what I mean. Read about it. Is this medication right for me? Okay, I've got diabetes and I've been prescribed the medication. Now Google is telling me that there could be a side effect that could further worsen my diabetic status. If you get what I mean, that is you empowering yourself. That is you, staying knowledgeable about yourself, about your care, and that way people will not endanger your life, just like Oluwatoyin has said. Simisola also said, like, you read my mind. I was going to suggest signing a petition. I'll find out about it really. But everybody have come to realize in Nigeria, or maybe generally, we have this, oh, what is my business? Are we just saying it? What has been done so far? Why are you talking about it? It is what it is. It is not what it is. If it affects somebody's integrity, if it makes anybody feel less of themselves, it is not what it is. And if we pay NMC, whatever NMC you belong to stay within the regulatory body, and they are not doing anything for us, to help us, to stand for us, then it is a shame. It is a shame indeed. So really, I'll look forward to this petition thingy, and I hope to get to the root of it, just so we can help ourselves. Please, let's sign this petition, let it get to NMC, and let NMC begin to action this thing for us. It is high time they started. Enough is enough. Stop treating nurses like sex tools. Stop portraying nurses as prostitutes. Stop portraying nurses as gossips and all of that. It needs to stop. Stop making nurses feel like they know nothing and they fall under every healthcare professionals. We don't. The common factor is the patients. So our roles are dependent, interdependent, and independent. There are things that I can do myself. There are some things that I need to do with the doctor and other healthcare professionals, physiotherapists, pharmacists, and the likes. And there are some things that we need to do together collectively. And that is why if you're in the UK, I don't know the kind of hospital that you are, we have ODUs. In the ODU, you have a nurse, you have a pharmacist, you have a doctor, you have, if possible, the social team, the discharge team sat together. That is a multidisciplinary team. At the end of the day, if I know nothing, if I'm under the doctor, I shouldn't be a part of that team. So nobody should be made to feel less of themselves as professionals. No profession should be brought down like it is nothing. We go through a lot to get our pins in UK, in Nigeria, wherever it is you've got your pin, in the US. You shouldn't be trampled on the floor like you are nothing, please. Also, somebody has said that, Lizzie Layemi has said that it's been a long time coming. Even the government itself needs sensitization. Oh yes, because they act like they don't know nothing themselves. So how can they help when they don't even know what's up? They don't know the difference between a registered nurse and an auxiliary nurse. When they see a white uniform, they see a nurse, full stop. Also, they should learn from NHS UK or US. That's right. Make them HCAs, nursing associates, or what have you. Yes. So here, something like what Yemi has rightly said. Here in the UK, as an example, I don't know how it works fully in the US, but here in the UK, we have registered nurses, and when they identify that they've still got shortage and all of that in nursing, they then brought up the nursing associate rule, and I think they started their program sometimes in, I'm trying to remember now, sometimes in 2017, 2018, and the first batch, kicked off either 2019 January or 2018 January. They started practicing as nursing associates. They are band 4s. They can do everything apart from IVs. They can do discharges. They can do everything. And their uniform is different from a nurse. They know their boundaries. That is how it should be. So if you need more nurses, how about you go through the nursing associate route? Or well, in Nigeria, we have healthcare assistants anyway. So that one has been in existence, even though some of them feel like they know more than you. Well, that's just by the way. That's not what we are talking about right now. So this is a very good suggestion that we can put in our petition to them, that please help us here. Also, Simisola says here that especially the young generation do not even mention I want to be a nurse anymore because of the mentality and what the public portrays of nurses. Simi, you're very, very right. When I started this video, that was the first thing I said. I said I didn't want to be a nurse. Not because I don't love the profession. Not because I don't want to help to care for people. But because of the impression that has been put in my head. This misconception that I've had growing up. That every nurse is lesser than everybody. The profession is so low to every other profession, and that is why I didn't want to be a nurse. Before I then gave it a thought again, and it's still one of the best decisions that I've made. I do not regret it, and I'm not lesser than anybody, irrespective of how good you are. I'm good as well. Do you understand? We can come together and marry our ideas together and our intelligence together. Now, my mom says, her name is Oluwatoyi Akimola. My mom says, you nailed it, my princess. You have made your own impact on genuine change on nursing's image throughout the world. Well done, Jerry. Thanks so much, Mom. And that is what I said about we making a change. Stop saying that it is not my business. Stop saying that how do I do it. If you don't know how to make live videos, educate people around you. Talk to your friend. You can have a blog. I think it's free to have a blog. Really, I stand to be corrected. Create a blog. Put it on Google. Begin to, promote it and let people read about nurses. Let people read about a standard nurse, if you get what I mean. And that is you doing your own part as well. Liz Layemi says they should assist qualified nursing practitioners if they must be in the healthcare sector by all means. Oh yes, they can assist us if you don't want to go through the nursing route. Jonathan, then don't be called a nurse. You can be called a healthcare assistant. You're still in the healthcare system after all. You can be called a nursing associate. You're still in the healthcare system after all. But do not be called a nurse because you don't have any training. You don't have any kind of a self-discipline. You go about sleeping around with people. You gossip with everybody you see on the streets. You wash your doctor's car. Then do not be called a nurse. You can be called something else apart from a nurse. We have a standard to withhold here. Do you understand? And we need to keep it way up high for ourselves, for our generations unborn. Because I know, if not anything, posterity would ask you and I what we did for our profession, how we've tried our best to better our profession. Posterity would ask us. So if not for anything, let's do it for our generations to come. And also, I don't think I have any other comments, and I'll see how long I've come in this video. So I've done it for, I believe, 40 minutes now, and that is just all I want to talk about. Like I said, I will find out about the petition. The summary is, please, every nurse out there, stand for yourself. If you are good and you know that you've gone through the rigorosity of becoming a nurse, you know your stuff, even if you feel like you're falling short, there are trainings that you can go for. There are free online trainings. There are things that have been put on the system for you to read on Google. Read up. If anybody mentions anything, you don't know it, read it up. Stay in the know. Another thing that affects with nurses is that sometimes, well, people generally, we're a bit lazy. We rather just want to ask hearing from someone else, or rather want to, okay, whatever the doctor says now, they know better now, Do you understand? No. I'm not saying that they don't know better. See, this is not a struggle of who is better. It has never been. Do you understand? I'm not bothered about that, really. What I'm bothered about is you as a nurse. I'm bothered about you. Do you understand? So keep yourself in the know. Stay abreast with quality practice. And by so doing, you can educate people coming, around you. Those that are not even nurses, you can educate them. And we can come together to stop this nonsense, because it is arrant nonsense. I think I've got a comment again. And Rachel Obaseki says, I don't think Nigeria's level of education and poverty is ready for nursing associates or HCA. Well, at the end of the day, when I was talking earlier, I talked about how even some people that are rich do not know the difference, or they are they seem to be learned. They do not know the difference between a nurse and a nurse. They see someone in uniform and that is it. They've seen a nurse. Do you understand? So, and they make them treat them. Do you understand? Whether they call them from the next streets, they take treatment from them. So it starts with ignorance. They don't even know. So if we can help them by educating them, if there can be forums that can be brought up, if there can be further sensitization, adverts and things like that put up, conferences and all of that made free for people to attend, to add to what they don't know or what they know, then it would help us. Then speaking of poverty level and education in Nigeria, that we are not ready for nursing associates and for HCAs. We have HCAs that the last time I checked, I stand to be corrected, but I think we have HCAs in Nigeria now. They're the ones that help you with turns and all of that. And the way some of them would even treat you, especially as student nurses, then they'll make you feel like they know better than you, they've been into it before you, you have to respect them. And all of these things, even amongst ourselves, we are fighting ourselves. I am better than you. Things that we need to really talk about in nursing. But you see that the things that we often talk about is hierarchy. Can we just, yes, there's hierarchy in nursing, but can we just face the things that matter, please? And stop this hierarchical fight that has been in existence since forever. Do you understand? So I think the healthcare assistant is still in existence, and for the nursing associates, I don't know, but if we want to put our heart to something, we can do it. Nigeria is not a poor country. Nigeria is just a country that wants to stay, ignorant. Do you understand? Because some people are embezzling our money and all of that. So I'd like to stop here, especially for my friends watching from Nigeria. And I understand that they probably want to conserve their data and all of that. I understand that those of us here were probably on Wi-Fi and all of that. So I try as much as possible to be considerate in my videos and keep it short and precise. So like I was saying, please, stay educated yourself, stay in the know yourself, stay good and brilliant and intelligent yourself, so that you have something to say to somebody when they think you are dogmatic, just to prove to them that I am not dogmatic. I'm in the know. I know the rationale for this. I've gone through nursing and I know what I'm doing. And that way I'll find out about the petition as well, if we can write letter, and I'll try to come back to everybody. Thank you so much for watching, and this is just like a way to air my mind out. And I really do appreciate everybody that has joined. For those that are just joining, we started about 45 minutes ago, and I'm just trying to be considerate with time, just so we can have time to go do other things, today. So I might have to end it at the moment. I don't know if anybody's typing anything. So I'll just wave to everybody that attended. I really do appreciate your presence, and I do not take it for granted. Thank you so much. And I'll come back to you about the petition, about anything that can be done to help us. And please stay proud as a nurse. Nursing is a noble profession indeed. We are great. We are better than we know. And I pray that the good Lord will reward all of our efforts by God's grace. Thank you so much for watching. I'm just waving at everybody right now. Tony was just replying to Rachel Ikaro now Baseki, saying it is achievable. The so-called auxiliary nurses pay for training. I believe you, Tony, because the video that I said that somebody sent to me, do you understand? The guy doing the video that was the person that did the video, my video keeps stopping, sorry about that. The person that did the video session of those little children of about 10-15 years old that are auxiliary nurses, you know, he said in his video, he said, how much do you pay? How much do they pay for this thing way they do? The boy said, oh, I don't know, now my mama they pay, but the same I can go do am, say so that I can become a nurse, since our school don't close because of corona, and they say more go do am so that we go be nurse. By the time we come back, we go come finish school, but we go don't become nurse. I be something and on like that. Truly they pay, so they can actually pay to become nursing associates as well. And also the so-called, okay, I just want to finish Tony's message. The so-called auxiliary nurses pay for their training, so they can equally afford NA/HCA training. True, very true. You don't have to get the government to actually pay for you. It's just about our own nursing council re-strategizing, going back to the drawing board, and then putting something better, like a better structure in place for nurses. And I really appreciate your watching. I'll go now, and I really plan to come back at some point with the feedback. For everybody that has stayed to the end, thank you so much for watching. I do not take your presence, your time, your data, everything. I do not take it for granted. If you've got any other thing to say, whether you're watching after this live session has ended, please leave it in the comment section. I'll be sure to reply you. And please remember to be a great nurse. Try to educate every person you know, and please stay abreast with everything that you need to stay abreast with. Oh, it is very important. It is highly important. Till we see again, take care of yourself and have a good evening. Bye.